I mean,
Well, Matt and I have had long conversations about sort of the decline of the healthcare industry in general, right? And sort of I'm on the front line, first through the wall for doctors that are seeing this, right? But if you start talking about this topic from a patient perspective, it's worse.
Yep.
Like it's pretty bad for us, but it's getting worse for patients, you know.
Yeah, it's well known that you get injured and you go through the machine, and then you just see the doctor for 5 minutes. They pop in technically, and then they move out, and they're just a part of this cog in the wheel. And people try and blame different aspects of the business, big money, insurance, all this stuff, but it's just kind of become that way one way or another. And so hearing what you've done, it's pretty damn incredible. And I could comment on so many things like the priceless aspect of just having sane mind and being in charge of your life and all these decisions, sitting down with the patient for 30 to 40 minutes, setting expectations. That's all phenomenal, fantastic. And I'm sure a lot of people who are going to hear this are nodding their heads or maybe thinking through different things. But what I know is more recently, so I haven't, in speaking to doctors and residents that I'm not selling to, and now more often because I'm not selling right now, it's more often. I'm getting a sense that they're realizing, is it really worth what they thought it was going to be, becoming a doctor? And I think that's always happened, right? Like you make this commitment, and then you approach what you start to see what it's going to be like, and you're like, oh, I signed up for this. But now more than ever, I feel like it's is there a way to mitigate this? Maybe I can be part time. Like I know a doctor who's been doing it for years nearby, and he was actually having a discussion with another surgeon. They said, just cut our pay in half. We will see the same we'll manage the same practice together.
Yeah.
And the hospital was like, no way. They were like, well, then we're both leaving. And they were like, well, wait a minute. Right. And they were like, we just need a life. Right. And then
Right.
in talking to another resident, she's just like, I'm super passionate about this. And it's not about the money. And in order to make money, I'm going to have to like not have a family essentially, and not go back to North Carolina and visit my parents and go on the boat with dad and stuff. I value that. So I'm trying to figure out a way where I can manage and make good pay off all my loans when I'm done, right? And so what you're saying right now, leads to, I can't help but think about that. I feel like some people feel like they're stuck. There's a mix of, I put all this time, effort, I have a passion for it, but I'm a part of this monstrous machine. And what are the alternatives? And you're talking about one right now that seems to check a lot of boxes of things that people wish that they could do or have. It's pretty incredible, really. I went to your website and there was prices on there. I'm like,
Yeah.
wait, a doctor has his prices like laid out. Like, yeah, that's a part of the thing, is trying to figure out what's the cost of this going to be.
Yeah.
Very cool.
Yeah. It's interesting. You're very insightful, right? Because a lot of people, I mean, even people who've gone through medical school and got into residency still don't realize what this life is like, you know. And it's an interesting parallel to the people that are just about to go into medical device sales, right? Like it's kind of an interesting parallel, right? Because the common denominator is you are probably going to be pretty busy, right? And this generation of people behind us is very interested in work life balance, right? And what it's going to be, how intense is your career going to be, and how committed are you to that, right? And you are exactly right when you say it's sort of this machine that chews up the people that work for it and spits them out, right? I mean, COVID was a great example, right? Like there was this sort of nationwide crisis, and the people that got hit hardest were healthcare providers, you know? Like there was no all the things wrong with the healthcare system were amplified in COVID, right? And so, you had people that came out the back end of that were like, whew, I'm not sure I'm cut out for this, you know? And there's no other profession in the world that's like that, you know, where just the demand um, on your time and on your effort and on your energy and on your focus, it does take away from, what kind of life you want to have, unless you find an alternative, right? Like I have.
Yes.
I do think that younger people are probably stepping back, maybe from medical school and saying, maybe being a doctor isn't all of that. Maybe I will be a PA, right, or a nurse practitioner, and I can mitigate some of this stuff, um, and still sort of have the joy of patient care. Um, that works well for some personalities, right? It's a little tough to not be in charge,
Yeah.
you have to sort of accept that. But I do think you're right. I think people are starting to come out of their training and maybe rethink what kind of role they want to have, because the healthcare system is such of a monolithic, machine, that they can't really penetrate it and make it what they want. Like, I'm lucky that I can, right? Like, I can still function in the healthcare system and make my work life what I want it to be. But there's no other practices out there like mine that will let you do that, you know?
Yeah.
Um, Even things like plastic surgery, for example, comes to mind, right? Because they're not as much a part of the healthcare system. And they do charge their fees ahead of time. And it is a little bit like kind of the model that I'm using. Um, but there's a lot of other stuff that goes along with being a plastic surgeon, that isn't. Um, I don't even know how to describe it. It isn't as much a doctor-patient relationship, right? When you're doing cosmetic stuff, you're not really saving anybody's lives, right? And
Yeah.
you're putting them at risk. And they're choosing to do that, right? Which is why it's sort of an elective type of specialty,
Yeah.
and it's just a different relationship that you have if you're a plastic surgeon. But that's a model, right, where you can be pretty free of the healthcare system if you want, and you don't have to rely on this antiquated third-party payer system for you to get paid, right? Like the patient's writing you a check for what
Right.
you're doing. So there are alternatives for the young person, right? Like, you could be a PA, you could be a nurse practitioner, you could go into medical device sales, you could become a plastic surgeon, you could, you can do things to get out of and away from this sort of wretched system that we're in, as a provider.
Yeah. Interesting. I would say you have the best of both worlds between traditional healthcare and surgery versus cosmetics, where, you know, someone who's going in for a rhinoplasty, they're probably asking around who's good at this, and then after they decide to pay the thousands of dollars for their facelift or whatever it may be, they look in the mirror and are they happy or not? And then it's where they come to you. It's like, I can't rotate my wrist. I can't work.
Yeah,
It's
yeah,
function. It's not for pleasure or
yeah. I fell off
whatever it may be.
and I can't walk, right?
Yeah, yeah.
Yeah, yeah, like,
I
yeah. Happy to help you. You know,
I can't lift my child. I can't go to work.
yeah,
Please help me. Take my money and
right.
bring me back to
And
normal.
and you're right. I mean, that's a different relationship. You know, and in my opinion, it's a better relationship, right? Because you really get a better sense of, accomplishment when you see that person back on the golf course or whatever.
Matt, is there anything that you wanted to go over?
I think I was just thinking about what he's talking about from a standpoint of, I think that Dr. Myers is he's the first one through the breach, right? He's one of the first ones through the door to say this system is so screwed up. I'm going to change the model in order to have a better life and still do the things that I want to do for patients. And I honestly think that in the next few years, we're going to see more and more what I would call concierge medicine doctors that are going to say, you know what, I've had enough. I'm good enough. I've done enough training. I have enough skill set. people are willing to come see me and willing to pay, I'm opting out of the health insurance company model. I'm getting away from all that, and people are going to pay me out of pocket to do the surgery. And I think they'll get great care from those surgeons that decide to do that, that are willing to take that risk and put them. I think part of it is maybe that surgeons aren't willing currently to do that. I think they're scared. Am I going to make enough money, or am I not going to make enough money? Blah blah blah, whatever you want to call it. Versus, I want my life back. And Dr. Meyers has been courageous enough to say, I want my life back, and I'm tired of dealing with the things that I should not be dealing with because I'm beholden to the insurance companies to pay me to pre-authorize the surgery that I know is right for my patient, and yet I'm still running into this wall. So I'm like, I'm just going to tear the wall down, and everybody's going to come see me straight. That's basically the model. I mean, that's
You're right.
honestly that's the way it should be that way, and I think we're going to be seeing more and more of that going forward. And I think in all specialties, not just. I think plastics has been doing it for a long time because let's be honest, people are vain and they want to look better and they're willing to pay the money. It's so crazy to me that we've gotten to the point where now people are like, well, I don't want to pay the money to have my arm fixed unless my insurance is going to cover it. I'm like, how are you going to live life if you have a broken arm or you can't function and you're unwilling to pay the money? I don't understand it, right?
Yeah.
And part of it is that we're all paying for it because if we have health insurance. I have a buddy of mine that writes on this he's brilliant. His name's Preston Alexander. And he goes, do we realize that we are all paying money for access that we then pay more money in order to get healed? Isn't that crazy that we're paying money to have access? That's what health insurance is. And he goes, oh, my employer is paying for it. No, your employer may be paying for it, but it's coming out of your check and you don't realize
Your
it.
check.
So
Yeah.
we are all part of that. And it gets to the point where it's a house of cards, and eventually it's going to get blown over because it's sitting there waiting to explode. And surgeons, people like it's waiting to explode. And we've seen already, and I hate to say this, some violent activity in the past couple year of people are fed up with being part of that insurance cog in the wheel situation, and that
Yeah.
it's reality. I mean, unfortunately.